Hey everybody, it's Sean, your local sports dietitian out of the ATL. Today I'm going to talk about lab work, biomarker testing. What is it? Why do we need to do it? How can it be important for you as a general pop, or how can it be important for an athlete? I highly recommend getting labs done. It's going to allow you to not guess if something is low, deficient, give you a better idea if it's normal, if it's an optimal range, if it's low, high, if it's high, normal, if it's out of range. Don't put your health in jeopardy and just guess and hope if you take supplementation it's getting your levels back to where they need to be. Put the work in it and make sure you're taking the proper approach to allow yourself to have the numbers so that way you can take an actual educated approach with your supplementation or including foods that are higher in those nutrients to get your levels back up to normal so you don't put yourself at risk for illness or high risk for injury. Now, how do we get those things done? One way is you can go to your doctor. The unfortunate thing with insurance and some physicians, not all physicians, but some physicians, is that insurance may not cover certain lab tests that need to get done. And the unfortunate thing about that is, there could be some things that can be definitely preventable if we were able to get the blood work done and be able to see and take the correct, appropriate actions for it. But with our reactive healthcare system, unfortunately, until people are having symptoms or until something is occurring where it's a concern, we may not be able to get that test done unless it's validated to do it. Now, if you want to take obviously things into your own hands, there's an option like Merrick Health, where you're able to get a variety of different blood work done at a price that's nowhere near what an insurance company would charge you. They provide you a portal. They provide you the opportunity to connect with a doctor and individual to review those labs as well. So you have an idea of action steps you need to take. Also, including your sports dietitian in those is going to be super important. So that way you're making the right decisions and seeing if there's certain foods, micronutrients, things you're not including in your diet, and how can we do that through your meals and your snacks. How frequently should we get blood work done? I typically recommend a minimum of 1 time a year up to 4 times a year. So that would be every 3 to 4 months. Your body's going to change. Your activity is going to change. How you eat is going to change. Nothing's going to ever stay 100% stagnant the entire year. So it's very important that we're consistently checking these things. So based on our different stressors and environmental factors that can affect our body, we can be able to stay on top of it and have an idea of what's going on inside of us, so then externally we can make the right decisions and changes to allow us to hopefully put ourselves in the best position to optimally perform as an athlete.